am honored to be here to kick off our Nursing Week book club. I'm very excited to dive into talking about this book. Before we start, I just want to give a quick heads up that we are going to do a draw for a prize at the end of the session. So please try to hang around until the end so you can be included in the draw. And before I turn things over to our host, CEO Diane Martin, I'd like to begin with a land acknowledgement. So WeRPN is located on the traditional lands of the Anishinaabe peoples. I am hosting the session from my home in Waterloo region, which is of the Haldeman Tract within the territory of the neutral Anishinaabe and Haudenosaunee people. With this, we respect the long-standing relationships that Indigenous nations have had to the land, as they are the original caretakers. We acknowledge historical and ongoing injustices that First Nations, Inuit, and Métis people endure in Canada, and we accept responsibility as a professional organization to contribute towards revealing and correcting misinformation, as well as renewing respectful relationships with Indigenous communities through our teaching, research, care provision, and community service. So I'm now going to turn things over to our host, Diane Martin. Diane is the CEO of WeRPN, and she also has many letters after her name, including RPN. So Diane started as a nurse in 1979 when she was about 10 years old. She graduated first as a registered practical nurse, and then in 1998, she graduated as an RN with a diploma in nursing, and today is duly registered as both an RN and an RPN, which she's always proud to share. She subsequently has obtained a Bachelor of Science in Nursing from York University and a Master of Leadership from Royal Roads University. Currently in her role with WeRPN, she's been recognized for her work to build bridges for greater understanding, clarity, and respect among the categories of nurses in Ontario. And the list does go on, but I know that Diane's excited to start talking about the book. So I'll just close by saying that Diane's always proud to share that she's the daughter of a nurse and a mother of a nurse, and she holds all of those who care for others in the highest regard. So with that, I will turn it over to you, Diane.
Thank you, Julie. And I'm really excited to be here today to share this book with you. I'm going to tell you a couple of things first. Here's what's really interesting. This just happened 2 hours ago. My husband and I were out, and I said to the person that we had our meeting with that I was a nurse. And he said, "Are you an RN?" And I said, "Yes." And I realized that I work as an RPN now, and that RN thing was kind of back in the back of my brain. And then I remembered, oh yeah, I am one of those too. And I think I must have sounded very odd because my husband said, "She's both," because I think it was a little weird. The other thing I just want you to know that I have my RPN hat on all the time, as anyone who works with us can tell you. I also want to tell you that we did a session on something else last night, and I heard later that someone thought that I was very emotional throughout it. I'm not, although you will be if you read this book, but really I have allergies so bad right now. So if I look like I'm weeping, as these lovely ladies are talking, I'm not. I really just have allergies. So I just want to thank everyone for being here. I just can't think of a better way to spend tonight than talking to the two authors of this book, which, by the way, I have with some highlighted marks in it, but also I have the audiobook, which if you're in your car at all, get the audiobook because it is, you will talk back to, you will answer some of these issues. And I think you could always tell which of these two authors' voice it was by the tone, and maybe they had two people reading it, but it is just the coolest thing. Oh, you did? Okay, it's just the coolest thing to listen to, but the paper copy is something you can always have. So I want to first introduce you to our authors prior to telling you a little bit about the book. So first of all, Varley, RN, BSCN, Masters of Science in Nursing, is a passionate advocate for nursing, mental health, and women's rights. With a bachelor's degree from University of New Brunswick and a master's degree from the University of Toronto, she specializes in women's health and transgender medicine. Amie has a diverse nursing background, including roles in labor and delivery, education, and quality improvement. She is dedicated to fostering inclusivity and combating discrimination in healthcare. All of this you will know when you read this book. So our second author is Sara Fung, RN, BSCN, Masters of Nursing, a dedicated advocate for nursing and healthcare equity. With a bachelor's from Western University and a master's from University of Toronto, she specializes in maternal child health. Sara brings over a decade of nursing experience, including roles in obstetrics, NICU, education, and professional practice. As a mother of two, she is always active as a resume writer, interview coach, and podcaster. Striving to support fellow nurses in their careers, Sara is deeply committed to addressing issues like anti-racism, mental health, and improving working conditions within the nursing profession. And her story is very riveting as well when you hear about just what it feels like to be under huge pressure within your nursing career. So both fascinating stories. Tonight, we're going to spend a little bit of time, after I tell you a little bit about the book, I'm going to spend a little bit of time asking the authors some questions about themselves and their experiences with writing the book. Then we want to turn it over to you. And you can start anytime you want populating the chat area with your questions for these authors, because we'd like you to have a chance to really ask those questions. I want to acknowledge from my role at WeRPN that a lot of the stories are centered around RNs, which of course makes sense because that's their lived experience, but not all of it. And what I hope is that everyone sees themselves in these stories. I certainly did, having been a labor and delivery nurse, postpartum nurse myself. In my first role, Sara was in professional practice. I could so relate to those stories. I think it was Amie, maybe, but when I was studying to be an RN, the professor that taught us, teeny tiny program in Owen Sound, the professor that taught us the most was Kathy White Williams. I couldn't believe that she appeared in the book. It was so cool. So, but you'll see yourself. It doesn't really matter what your background is. You will see yourself in this book. I told the authors it's like 3 o'clock in the morning when you're sitting in the nurse's station and you're sharing some stories or remembering things that had happened, and I found that I couldn't stop reading it. You know, once you get into it, you just want to, if you've been missing those times like I have, you'll find that it's pretty familiar feeling to exchange like that. Having mentioned I'm going to tell you a few things that are in the book that really touched me before we launch with our questions. So firstly, here's some quotes. We are among the few professionals that are present at the beginning and end of life, not to mention all of the times in between, and on the best and worst days. And nurses are the backbone of the healthcare system. We think we're more like the heart of it. And I would absolutely agree with that. I think it's a really profound, honorable profession. When it comes to our clinical practice, which we all do at some point in our career, starting an IV or dressing a wound or giving an injection, nurses are so much more than the list of tasks we perform. They're the hand the patient holds when they're in pain. They're the encouraging voice that gets a woman through childbirth, the shoulder to cry on when you receive a devastating diagnosis or a loved one passes away. And the interesting thing that you'll find out in this book is that, like all of you, these authors have been on both sides of healthcare. So that so humanizes it for me. We're the ones that spend the most time with patients when everyone else in the hospital seems to be coming and going, moving in and out of the patient's life. And because we spend so much time with them, we're often their best advocates. Our cumulative experience is one of wisdom. that plus years of intensive study. And all nursing education, unless there's anyone out there that thinks the practical nursing education is easy, it's not. I've taught in that program. It's not easy, but all of us have stretched ourselves very thin to get to where we are. For the same reason, we're also the best advocates for ourselves in our profession. As a group, we have agency. Our gentle hands can braid your hair in ICU, but when it comes to protecting our healthcare system, they can hoist a placard as we march the streets. And I certainly have marched the streets. Excuse me for a second. The nice thing about always working with nurses is they don't mind if you blow your nose. Okay, and just a couple of quotes because most of our audience will be RPNs. There's a section in this book about Lindsay Pentland, and many of you will know that she's a member of our board. I didn't know that when we booked this, but Lindsay let me know. But let me just tell you a couple of quotes from that section. The difference between RNs and RPNs comes down to education. While both are taught from the same body of knowledge, RNs study for longer periods of time, allowing for greater depth and breadth of foundational knowledge and expanded scope of practice. At the end of the day, both are nurses. So these authors absolutely recognize that. And here's something else they recognize that I think it's really amazing for us to hear from them right in their book. The skill set required of RPNs like Lindsay has increased dramatically over the years. Salaries, on the other hand, had not followed suit. A couple of other incidents further drove home the conviction that her profession was treating her less fairly. And then the book goes on to talk about the lack of support we have when we have to bear witness to something very traumatizing and are expected to 5 minutes later walk with a cheerful face into our next patient. So there's lots of profound moments like that in the book. But just before we start with the questions, I wanted you to know how deeply these two nurses understand the role of the RPN. Okay, so let's hear from these two authors who tell, the best stories. Some of them are very serious in dealing with very difficult matters, and others are very much the day-to-day joy and fun we have with our colleagues. So first of all, for both of you, whichever one of you wants to take this, how long did it take to write this book? And what was your process?
Sara, you want to start?
Yeah, I think book writing is one of those things that you don't realize how long it takes, right? You think, oh, I write it, it's there, and it's done. But for us, it was actually almost a 3-year long process. So it took Amie and I about a year to come up with the concept of the book and the outline. And if anyone's listening to the podcast, you know Amie and I have very different personalities. So it took a little bit of time to land on a topic and what we wanted it to look like. The actual writing process is about a year as well. So, every single chapter, every single line, we combed through it many times. We worked it, we reworked it, we consulted with each other, and then comes the editing process. And that is another challenge in itself. So there was a lot of shifting of the chapters, should we expand on this story? How does this sound to someone? And actually the book is for the general public, not just for nurses. So we really needed non-nurses to read it. And sometimes there'd be acronyms that we wouldn't even think about. Like we would say, well, we're going to DC this patient. Well, what does that mean? Like
Right.
a lot of people had to remind us that, there's this lingo that we have in nursing and healthcare that not other people understand. And so it was really, for me, it was really therapeutic just to be able to share my story really from the time I was a kid and decided I wanted to become a nurse to where we are now and how we got to where we are. So it's definitely an eye-opening process. And I think that it's well worth it, of course.
Yeah, it was definitely a journey. 3 years is a long time. We did have a lot of support though. So we did have the support of our literary agent, which makes it a little bit different because we're not self-published. We are with a publishing company. So we did have some support in that way in terms of just saying, hey, this doesn't make sense. I would say probably the hardest part was the editing because we probably had about 10 reads back and forth, going through, changing. They probably maybe as hard or harder than a thesis, a PhD thesis, because it was just a lot. Yet we started, I think, with 100,000 words, and we had to come down to 80,000. So there's still much more to say. Stay tuned. Maybe there'll be another.
You know, throughout the book, you can tell that the two of you are very different people. And yet somehow you, and if we all think about our friends, somehow you two found each other and it clicked. And throughout your career, and the similarities in your experiences seen through different personalities, fascinating. And yes, I have to agree, like, I think anyone could read this book and know, and you take care to also not make it too Ontario centric. You
Right.
explain where we are in the world, and locate us people to whatever city might be closest that people would know. Like it's not even something that is just will make sense to Canadian nurses. It'll be anyone who wants to know more about our experiences. How did you get there? What inspired you to write this book?
Yeah, maybe I'll start with this one. I think the inspiration for writing this book came out of our nursing experiences, right? I think before the pandemic, myself and Sara were both in roles that were very traumatizing to us. I think every nurse has probably had some form of experience with some type of lateral violence or nursing bullying. But this one for us was quite instrumental. And it was kind of strange because we didn't really talk to each other about what was happening. Like it was happening on my end, happening on her end. We shared an office, but for whatever reason, we didn't share the fact that we both were being traumatized in this way. But we would actually have these venting sessions where we get in the car and we would talk. She would be driving to Toronto, I'd be driving back to Brampton, and we would talk about our experiences. And through that trauma that we really had, I remember I actually quit my job with no prospects. I didn't have any job lined up. I just knew that staying in that environment was way too toxic, and that like it would eat me alive. It was something I could not stay in. And then I believe Sara actually had quit 2 weeks after me. And then just realizing that, like nobody, you would think that in healthcare that there are people that would care, it's literally in the word healthcare. And we were finding that a lot of the leaders, they didn't. Particularly from a mental health standpoint, there were no supports, no resources. Nobody really even tried. I remember when I sent in this letter to to that organization that they're like, oh yeah, we're gonna put some steps in place, and nothing. And I said to Sara, you know what? My cousin had a podcast, and essentially it was just her talking about her experiences. I said, why don't we do the same thing? Who's going to listen? Like, no one's going to listen. But at least, it's like a journal, but it's a live one. So why don't we just tell our experiences? And that's kind of how it started and how it evolved. When I would have never imagined that we would start writing a book, but that's pretty much the evolution. We wanted to really one, share how we were feeling because we knew other nurses had these experiences, and two, there was so much about nursing that people did not understand and did not know, and we want to kind of correct that.
Yeah, and with writing the book, we had been thinking about it for a while, but we just didn't quite know how to get started. And I think that with the book and the chapters, we were very intentional to be as inclusive as possible. So, Diane, you mentioned that Lindsay Pentland has a chapter. There are two other nurses actually that have chapters. So, Amie's cousin Matthew is actually a RPN that recently got his RN, and another nurse named Rachel Raddick, who has been championing Indigenous issues. She is a recent RN graduate, and she started as an RPN. So we really wanted to bring these stories to light. And I think with a podcast, we share little tidbits here and there. And as you know, podcasts are not long form types of content. So we really wanted to be able to share a complete story of our experiences. And I think the book was a really good way to do that. I
Yeah.
also think that, like you said, Diane, we wanted to be inclusive of issues across Canada and even in the States. So some of the chapters do feature nurses in the States, and we have a chapter dedicated to Redonda Vaught too, which was something that happened in the States that was a really big deal.
Yeah, there's really large overarching stories, and then there's stories that are shared experiences with all of us. Some nursing school stories, some interactions with patients stories and each other that are shared experiences. But I think the stories about those amazing nurse leaders and even the short bits about some nurse leaders who are no longer with us really give us that sense of the history, the amazing history this profession has. So it's not just a book about there's a lot of lighthearted moments, but it's not just a lighthearted book. It's actually got a lot of solid pride in nursing, but also the hurt in nursing. And both of you do a really good job of. I felt like a panic when I, read some of the pieces about when you couldn't get what you needed in the profession. I it's just a very, very difficult thing to read, and especially if you've experienced it in any way, which at this point most nurses have. But did you always know that you were going to include other nurses' stories, or did that evolve?
I would
I
say,
think,
yeah,
go
go ahead,
ahead,
Sarah.
Amie. I think it
Oh,
was an evolution. I guess this is where when we said it took a year, it really did take a year because I personally haven't read that many books that have been written by two authors. So that's a new thing in itself. So trying to figure out how to combine our voices, how to bring other voices in was challenging. But I think we always knew in some way we wanted to highlight other nurses who haven't been highlighted in the past. And that was always something we felt very strongly about.
yeah, and I would say it's
So,
actually very similar to our podcast, right? Sorry, Diane, to cut you off there.
okay.
It's
Nope.
just similar to our podcast. Our podcast elevated other, not even just nurses, but other voices. I think that was kind of a part of the point of making sure that it's not just our voices that need to be heard, because it's not just us who are that needs to be at the forefront. It's all of our voices. So we want to make sure that there were some that we did hear from other people and hear other experiences, because it's within those other experiences, that likeness, that we know that we're all connecting together.
So, so to take a platform and give other nurses a voice, that's amazing, first of all. But was it two different people voicing the stories in the audiobook?
Yes.
It was two
Yeah.
different people. And
Yeah.
actually, Amie and I, we had asked for people of the same ethnicity as us to voice us. So I picked someone that was of Asian descent, and Amie picked someone that was Black. And that was important to us as well. So we were able to bring that to life.
Because I'm listening to the book, driving along, and I think, oh, Amy's talking now. Like it's just, and then I thought maybe they're reading it themselves. But then I thought, I don't think so. These sound like professional voices,
Right.
but it's wonderful to listen to because you know which one of you is storytelling at that moment. So that was really great. Um, so you stress the importance of the public's knowledge of famous nurses beyond Florence Nightingale. By the way, my middle name is Florence. That's a true story.
That's so cool.
Um, but so what you do in the book is feature nurses with grit who sort of blazed a trail. And, um, how did you decide what's the genesis of including the nurses with grit? And also, how did you decide who to include there?
Yeah, it was challenging. It was quite the process, actually. So we had, of course, as nurses, we had to do our own research. We dug right into the books to kind of say, like, who do we think what voices have we not heard from, or what stories haven't been told? And I think that kind of helped us kind of figure out which names we wanted to put in there. And some of it was just, surprising to us. I was really surprised to know that Harriet Tubman, you think I would know that she was a nurse. I didn't even know that. I didn't even know that she lived in St. Catharines. So some of it was just like, oh, there's connections to Canada, there's connections to Ontario. How do we need to talk about these individuals? And then some of it was just, we found that person very, very interesting. We haven't heard much about their story. And again, it's just really kind of illuminating and lighting up those voices that we hadn't heard. And but we definitely wanted to be a part of our book because we need to hear other nurses that had grit. And I think that, we wanted other people to say, hey, let's investigate these other nurses, because when I think back to nursing school, there was always the similar voices, the similar nurses that we heard from, but there were so many amazing nurses that we hadn't heard about, and we want to really include them as nurses with grit.
Yeah. Yeah, and the book opens with, can you name a famous nurse that's not Florence Nightingale? And so the reason we go through all of these other nurses is that by the end, hopefully you can remember some of them and think about these other nurses that did really great things and had such great accomplishments that just for whatever reason haven't been highlighted throughout history. And so The Nurses with Grit, I think, is just a little snapshot into nurses that didn't get the attention they deserved. And it was another way for us to include even more voices, because a lot of these Nurses with Grit have passed on. And so
Right.
obviously they could not be interviewed for the book, but it was a way of honoring their memory and what they brought to nursing.
Yeah, some of them I knew, some of them I didn't know that I knew. I mean, Natalie Doucette, for example, I see her name on emails that I'm included in, but I didn't know anything about her, and it reminded me, even the people I interact with every day, you don't know their story, and the
Right.
stories are amazing. But the ones from the past that really changed, I didn't know any of them, virtually none of them. And I knew about Tubman, but I didn't know her history at all. And of course, she was an incredibly remarkable nurse. So, um, you know, living in your book kind of takes us into what's really familiar and feels like, you see me. And then you also learn about this history while you're reading it. And those are just short little pieces about those nurses. It's not a history lesson. It's just letting you know what came before you. It's quite an interesting read because of that. So here's an interesting question. If your book was made into a movie, who are you choosing to play you?
Oh, wow, that is challenging. Oh my goodness. If it was made into a movie, who would I choose?
Oh, this is tough. We have
You
not
know
been asked
what?
this question before.
I might choose Viola Davis only because I think she's amazing. I mean, although we might
Exactly.
not look alike, I just think she's a phenomenal actress. I just recently actually read her book too, and her book is very, very powerful as well. And I would choose her. So that's who I would choose to play me.
And she has grit in every single one of the roles she plays. That's brilliant. Sara, what do you think?
Okay, the first person that came to mind, she makes me laugh. And I know we don't have the exact same personality, but I just immediately thought of Aquafina because
I knew you were
Aquafina.
going to say that. I absolutely knew you were going to say
you
Aquafina.
did. So that was
Yes,
my first choice. My safe choice would be maybe like Michelle Yeoh or someone like that. But
yeah.
Aquafina, I love her. I think she's funny. Amie and I have talked about this. We thought, what if it were turned into like a film or a movie? How great would that be?
I only knew when you said we don't have the same personality, because you don't, but I immediately went to Aquafina because when you watch Aquafina act, she she feels things. She's funny, but she feels things. So I knew
Right.
you were going to say that. Okay, well, let's make that movie, because I think that would be
Why don't
amazing.
we?
Exactly. So, what are the two of you working on now? You have your podcast and you have this book that I know is keeping you really busy. And I know your personal lives are also very busy. But what are you working on now that we need to know about?
Do you want to start, Sarah, or do you want me to
Well,
start?
I mean, the first thing that comes to mind is I can share what we did today, right?
Sure.
So,
Yeah, absolutely.
yeah, so we recorded a podcast episode with Justin Trudeau this afternoon, and it's going out tomorrow. And that kind of fell into our laps. And so we took that opportunity. It was not something we ever expected to happen, but I think with the podcast and the book, we're continuing to build who we can talk to, and to have this opportunity to talk to people of influence has been really huge. So whether it be having people come onto our podcast or doing talks like this to nurses and other professionals, it's something that we've been working towards for a long time. And just fun little things like I look at, so everywhere I go now, I look up where's the closest Indigo, and I go to sign those books, and it's a lot of fun for me. And I know Amie does as well.
Yeah, I mean, it was again, like Sarah mentioned. Yet we interviewed the PM, and I was able to get in a couple questions that I think that a lot of nurses would like to know. And I think it's not, again, it wasn't RN specific. It was just about nurses, because we all are
Yeah.
nurses and we need to ask some of those questions. And then of course we had a little bit of fun at the end. But in terms of some of the work that I'm doing, so of course I do work outside of Gritty as well. I had the opportunity, and I'm still working with CIHI, so the Canadian Institute of Health Information, and actually actually we're looking at how do we diversify patient voice, and I think that's the other piece that I would love to kind of do some more work on, and maybe we can, again, because we do bring the patient voice sometimes to our perspective, but I think that we need to hear more from the patient perspective. So I've been doing some work with Kai Hai, and I think that, Gritty Nurse is continuing to evolve. I think that we're going to continue sharing stories. I don't know what exactly is next. We're kind of just at the edge of our own seats, and I don't even think I fully had to digest that we're national bestsellers because I just had a baby 5 weeks ago. So yeah, I think we're going to continue to evolve, and we want to pull more people along on this journey. I think that's one of the things that Sara and I have always wanted to do, that it's not just about us, it's how can we bring people forward and bring people on the journey with us. So if you're listening out there, we're always looking for great people.
Fantastic. There's hearing from patients is something we don't do well. And when nurses are telling about their experiences, sometimes we don't relate it as well as we should to how that experience was for the patient. In your book, however, you've had enough interactions with family and yourselves, with the healthcare system, that we realize that we've all also been patients, and that we have some of that knowledge and we can share that. So we have some questions.
All right.
Let me just have a look here. Nancy Snowblin would like to know, how did you pitch the book idea to a publisher?
That is a great question.
That is a good question. So maybe I'll jump in, and then Sara, you jump in. It was actually this was actually a very unique situation for myself and Sara. I think we had started the podcast, and for whatever reason, the pandemic had hit, and for whatever reason, like we said, we didn't think anybody was listening. We just kind of were telling our stories and our truths and what we experienced. And one day we got an email that came in. It was from a literary agent saying that they wanted to write a book with us, and I was like, "What?" And Sara, as you probably know, as we both have different, different ideas and different perspectives, Sara was like, "It's not legit. I don't think it's legit." And I was like,
No. I said we need to
real.
look this guy up.
We have to look this guy up to make sure he's not real. It's real.
Yeah.
And this individual was actually one of the biggest literary agents in Canada, and we just worked with him, and he our pitch was really bizarre, actually, Sara. It was we kind of had a couple of different ideas, and like I said, it was kind of an iteration, right? We thought this, we thought that. People were like, no, that's not going to work. They definitely did not want a COVID book because I think at that time many people were writing things about COVID, and they just said, you know what, we need a healthcare overview book, and people, how can people understand healthcare and your perspective from nursing much better? And that's kind of how we landed on it. And I believe the publisher was just kind of like, greenlight it. We haven't heard from nursing, so why not today? So I think we were I'll be honest, I think we were really fortunate. What do you say, Sara?
Yeah, I think so what happened, just to backtrack a little bit, is we were featured on an episode of W5. So we were on an episode of W5 called The Burden to Care, and we were actually talking about mental health and nurses that had died by suicide. And our literary agent saw us on that show and was like, yeah, why don't we have a book about nurses? And so he reached out to us, and I didn't say it was a scam. I said we people have pitched scams to us before.
Yes,
so when
we
looked
true.
This guy up, we realized he had worked with Chris Hadfield and a number of other authors. So we realized he was legit. And, just going back to how we said it took a year to come up with the idea is because we had to have a really solid idea. So our literary agent said, I'm going to pitch you to all the publishers, but you only have one chance. You have one chance to get a deal. If all of them say no, I cannot go back to them. This is dead if we don't get a deal. So that's why it took so long. And we're really just holding our breath, hoping that one publisher would want to take us on. And HarperCollins did take us on, which was great. And, we worked with them, and they really helped us. They helped guide us along this whole journey. And the thing is, like, no nurses, I don't think any nurses have ever been signed to this publishing house before. So they didn't quite know what to make of us or how we would do. But I like to say that we exceeded their expectations, and we definitely are bestsellers now, 5 weeks and counting, and we want to continue to surprise them.
And maybe this will, propel them to, reach out to more nurses, because again, like Sara said, they had they were kind of like, I don't know what's going to happen. We don't like, we've never really done this, but maybe this is just a shining exemplar of, they need to speak to publishers, need to speak to more nurses.
And they actually were
Yeah.
comparing us to how doctors have done with books. That's the only comparison they had, was like, oh, this doctor
Wow.
did,
Yeah.
right? So maybe we'll put you in this category of doctors that have written books.
But we did
Mm.
better.
I first of all, it's fascinating to watch you two talking, because when you finish this book, I'm gonna hold it up again. Love this book. When you finish this book, I feel like I know you. Like I feel like I know you, and you're exactly as you seem in the book. But I mean, there's a couple, you brought up doctors, there's a couple stories about doctors in there. And I've been a labor and delivery nurse. I know what it's like to call the anesthetist. I know what it's like to want to say, well, I'm going to write whatever you say in the chart, so just be careful here. You didn't say that, but that's what I was thinking when I heard your story. It's all very I just think that nurses will enjoy this book. So obviously, Mame, one of our board members, has asked this question, but obviously it's a very important one. What is the name of the podcast?
Oh.
It's called the Gritty Nurse Podcast. So you can Google that. We're on YouTube, Apple, every major podcast platform. We're there. You can listen right on our website, which is grittynurse.com. So you won't miss us. We're the only Gritty Nurse podcast out there.
Wow. There really is a space that needs to be filled with nursing, and I can't believe it's taken us this long to do it, but certainly engaging with that podcast would be a great step. So here's a question from Tiff. You've both built such a great platform for yourselves to raise awareness about nursing issues with your podcast and now your book. What's your advice for other nurses looking to speak out and impact change? And are you ever concerned about speaking out on difficult topics, whether it's broadly in the public or whether it's an interaction between you and your managers, because both of you have faced that?
Yeah, so I would say that one of the things is the whole reason we want to do this is so we can amplify and have other nurses be able to feel that they can have the conversation. I think we've talked about in our book and as well as in our podcast, we say boogeyman stories, because there are instances where the reason why nurses don't want to speak up are because of other nurses, and that's kind of a calling in and a calling out too. So something that we need to think about as a profession as to why there might be silencing within our own profession. And I mean, nursing generally. I don't think it's any different if you're an RPN or whatnot. I think it's just, this is something that we see right across the board. And we do need to see change, and we do need to talk about those instances where it's our own nurses that are actually the ones, calling and saying, hey, this person did this or this person did that. Like I actually tweeted just recently, one of the people that we featured in our book, a nurse complained about her to her manager about being in our book. And I was like, what is happening? I'm like, this is a perfect example of why we have issues. Like, why are we doing this? We should be building each other up. But again, I think that, we even had our own instances. I remember when I first started, speaking out very openly, I was working for an organization, Niagara Health. And I remember I actually had someone complain about my podcast, which is really bizarre because my podcast had nothing to do with Niagara Health. We don't have any affiliations with them. It's just, I am an employee of Niagara Health at that time. And I remember my leadership team pulling me in and was like, oh, we have to have this conversation with you. And, if this person lodged a complaint, we have to discuss it. And I was like, okay, well, what was the complaint? And they're like, well, you swear on your podcast. And I was like, do you also want to know what is in my laundry basket? Like what I do in my personal life is personal. And I think the organization was pretty shocked to be like, oh, that actually does make sense. And they actually ended up speaking to the other individual, being like, what she does on her personal time doesn't necessarily reflect Niagara Health as a profession. And Niagara Health became one of my biggest supporters in terms of some of the work that I did and some of the conversations that I had. And I think it's really about shifting the zeitgeist in terms of how we think about the conversations we have in terms of, politics and policy, because maybe we just haven't been seen in that space. And for some people it might be scary and intimidating. But again, I think it's a conversation we need to have. I even mentioned it to the PM today. He had asked us, what are some of the things that could be done better from federal levels and how can we support nurses? And I said, yeah, we might might need whistleblower protection laws that when we talk and we speak out, that we're actually supported, because we kind of done this alone, right, Sarah? Like we're kind of just out here and we don't have the protection of anybody except for ourselves, but we're speaking truth to power. So again, I think it's again having these conversations, coming together. I think we need to see unity in our profession, unity across the board, and knowing that you're speaking your truth. I think again, if you know that you're not speaking on behalf of an organization, you're not breaching patient confidentiality, you're well within your right to have conversations about health and healthcare. We actually have some episodes where we spoke to lawyers about the capacity and what we can and can't say. So I would say that there's probably a lot of room for you to have conversations, and always reach out to us in terms of how you want your advocacy journey to look like.
Yeah, and I think
Yeah.
also if you look back to the college standards, right? We should be advocating, right? So
Right. It's a
we
part of our
learn
work.
we learn how to advocate for patients as nurses, right? We learn how to care for patients, how to advocate for them. We need to just use those same skills and advocate for ourselves in our profession, because that's the only way we're going to move forward. So when Amie and I first started, we didn't have training. We just started building our platform and we spoke to the media. And I think that for anyone that's uncomfortable with advocacy, it's not really something that I grew up with, right? It's something that I learned over time. And there's many different ways to be an advocate. So I think when we think of advocacy, it's like, oh, you have to go march on a picket line. That's just one way to advocate. There are many other ways. You could write to your politician. You could find out what their platforms are. You could just educate yourself more on the different political parties and where they stand. You could get on social media and amplify it that way too. There's so many different ways, and there's no one right or wrong way. And I think it's something that takes time, right? And it takes practice to feel more comfortable to do these things. One of the things that Amie and I were very careful about in the beginning is that we didn't name any specific individuals or organizations. It was more about how can we advocate for better working conditions for nurses. So at first it was advocating for PPE. It was advocating for nurses not to be subjected to physical or verbal abuse on the job. We're advocating for, actually in the beginning, it was about paid sick days, and now it's about safe ratios. Like these things are all things that we can all benefit from.
Yeah, and I think the other piece, maybe just adding in, is a lot of my advocacy surrounded around health equity and anti-racism and things like that,
Mhm.
and the social determinants of health. So it's also about pulling that patient safety aspect in to say, hey, if we aren't looking at these various different aspects, we are putting our patients and families at risk. And I think that's another important part. That's a part of our job. We're supposed to be, people who come in who are ill, we're supposed to be making sure they leave better than they come in. But if we're seeing that, we can't meet some of the things that we want to, we don't have the resources that we need, how can we not say something about that? That is definitely a part of our job. And again, I always bring it back to patient safety and patient outcomes. Maybe that's my QI hat, but it's always about, at the end of the day, why
Yes.
we got into nursing. We should be making sure that we see better patient healthcare outcomes.
But we can also advocate right where we are.
Yep.
Sarah, I want to ask you, when you were breaking under the pressure of that professional practice job with a manager that was not only not supportive, but maybe striking fear in your heart, if a colleague had said to you, how can I support you through this? What different would that have made a significant difference to you? Are we not doing that enough?
I think, I mean, Amie was supportive of me, but I think if there was someone that could actually have made a difference, like maybe another manager, let's say, that could have changed the working environment for me, I think that would have changed everything, right? When
Yeah.
people say that people leave managers, they don't leave jobs. That is completely true in
Right.
my case. The job itself was okay. I enjoyed working with the staff nurses. I liked the hospital. It was just my direct manager was actively trying to make me fail, and I couldn't break through. I tried to go on
Mhm.
stress leave, I tried to do this and that, and it just didn't change.
Yeah.
And I felt like by the end I had no choice but to leave. And it broke my heart because it was a job that I thought was going to be my dream job, and it turned out to be the complete opposite. So in a way, I felt that I'd failed for a second time, that, you know, I was here in another toxic work environment, and how could I let this happen again? So I think that if someone had stood up for me in a way that changed the dynamic, that would have made a huge difference.
Yeah, yeah. I think sometimes in nursing, both, I think we're, we're bystanders far too often in this profession. I don't think it would take much. Even in this leadership job that I have now, there are nurses out there who have stepped in when nursing leaders from across Ontario who have stepped in when I'm having a weak moment and saying, hey, let me tell you a little story. And, you're fine. It's so important that we do that for each other. And both of you in this book tell personal stories that, I mean, I felt them. Sara, that was the one from you that I just felt that terrible feeling. Someone on our chat, Andrew, says, I got pulled in once to a meeting with my manager because someone complained that I was taking my breaks on time.
That's
So,
ridiculous.
isn't it? But I don't think that's an uncommon story.
Right.
Mm-hmm.
Yeah. I mean, sorry, go ahead.
No, go.
Yeah,
Absolutely.
those are those instances again where I talk about the call coming from inside of the house, where we need to really have some really strong conversations with one another to be like, why is that something like that? Something that actually is, mandated and is actually, from like a human legislation, like human rights perspective. Why would you be upset about someone taking their breaks on time? Or, even if someone wanted to leave or sleep on their break, that is actually something that is due to them. So why as individuals might that be something that we're struggling with, or we're upset about, that you would take that to complain? I think there's a huge conversation we need to have within our own profession. And I think, you kind of touched on a little thing. It kind of reminded me of the aspect of sometimes nursing leadership. And I'm not too sure why it is, because again, I think most of myself and Sara's experiences with bullying came from leaders where sometimes they get promoted up. It's a really bizarre kind of aspect where we need to really talk about it and talk about, why do we continue to promote toxic rock stars? And I do believe that there's a lot of fear, right? So maybe in Sara's instance, and I don't want to speak for Sara, so you could pick it up whenever you'd like, that, maybe people never called her out because they were fearful of that individual or whatever, or what the case may be. And I've actually even seen it outside of, hospital administrative walls. I've seen it across Canada, nursing leaders bullying other nursing leaders at high levels. And I'm like, wow, this is really bizarre. Why can't we get our stuff together and be more unified? But there is a sense where maybe somebody is a nursing leader and they're in a very powerful role, and people don't speak out about that. And I think that's something that needs to change.
Absolutely. Yeah, I wrote, or I was featured in an article that talks about toxic rock stars. And what that is essentially someone who delivers results on paper, but at the expense
Right.
of the entire team. So we really need to look at teams, and when there's high turnover, why is that? And one thing I've also talked about is when someone leaves a job, there should be an exit interview. People should be asking why they're leaving and not just assuming. And data is really what is going to inform these changes. We talked about this collection of data actually with Justin Trudeau today. Why don't we collect this data? And why do we assume nurses are leaving because of either the pay or the working conditions? Maybe it's their colleagues, and maybe we need to look at that a little bit more closely. And just going back to that comment about the break, maybe it was from a nurse who was jealous that they couldn't take their own break on time. So rather than trying to cut someone down, why don't we just help everybody take their breaks? I feel like this is something in nursing that really needs to be talked about more.
Yeah, or the ideas of martyrdom within nursing is like, maybe this person feels that this person's not being nursing enough, and in their days this is how things were done. Well, things are changing and we need to have different conversations as well.
And, Mame from our board, she just commented that people, often are policing other people's breaks. But I think it was Sara that came back from her break too early and
That
was
sounds like a Sara
chastised about
thing.
that
I don't
in the
remember
book.
that, but
Yeah.
it is
It might,
possible
it
that
could
I've
be
come
me, it could be
back.
Sara.
It was what someone had I can't remember the context. It might have been someone else talking in one of their
Oh,
stories. But
maybe it
the
was, it was
3 hour.
my night shift. Yes, my night shift,
Yes.
and I came back
Yes.
too early, and I was sent away, and I was like, I'm just trying to, I want to keep up with all the stuff that has to
You
happen.
wanted to get your work done for
Yeah.
because morning was coming and she had nursing care to provide, but she was in trouble because she came back too soon. And what are we thinking? You know, what are we thinking there? So to me, that was an interesting moment. Do you have a favorite story in the book?
Oh my goodness. This is probably the most nerdy answer. If anybody knows anything about me, I am a horror movie buff. So the ghost stories for me are my favorite. I had so like when we were writing them, we had such an amazing time writing these ghost stories. And this is a random aside as well. We were actually featured on haunted hospitals. Like if I think you had to have like TNE or some certain channel to be able to watch it, but we actually were featured and our stories were reenacted by like actors. So yeah, for me, I'm sorry, I know it's super lame, it's super nerdy. The ghost stories for me were so much fun to write. And yeah, that's kind of my favorite little tidbit there.
My favorite is
Yeah.
actually our stories about night shift, because I'm so surprised that people outside of healthcare are so interested in night shift culture. And I think even as nurses, you always feel strongly about whether you're a day shift or a night shift person, right?
Yeah.
But it's just amazing, like this whole world that people want to know about. And it's almost like on night shift, you don't talk about night shift. It's like Fight Club, right? So we don't talk about the fact that we take breaks. Although we're human, we never want our manager to know that we take breaks, even though I'm sure our manager, they've all been frontline nurses at some point and they know this happens.
Yes.
But it's like what happens on nights stays on nights. And that is the title of a
Yeah.
chapter because it's true. And it's very dependent on the unit culture, right? As to when you take breaks, how you take breaks, who do you take breaks with? Do you
For
even
sure.
get breaks, right? It's or even just like, the crazy things we get up to in terms of what you eat on nights. That's a whole other story in itself. But I found those kinds of chapters really nice to write about. It brought back a lot of good memories.
Yeah, absolutely. I had someone I worked nights with who at 4 o'clock in the morning had frosted flakes with 2 envelopes of sugar on them. Whatever gets you through the night. But I just wanted to ask you one last question before I throw it back to Julie, and that is um, the title. How did you come up with the title, The Wisdom of Nurses? Did that come first? Did that come last?
It did not come first. It was a really challenging process because I think that we were looking at all the chapters. We were kind of thinking about what direction to go in. We were having, of course, influence from our literary agent as well as our publisher. And it took a while before we landed on it because we wanted it to feel similar to what we were writing about, our experiences, and then also still be somewhat punchy. And oh gosh, we
Yeah.
went through a lot of different titles, and I'd say this was probably the last title that we landed on, and it took a while. For me, I felt like I needed to really sink in to say, like, is this the message? Is this what we are hoping for people to take away? And then eventually, I think, I can't speak for Sara, but eventually I was like, this is the title. This is the powerful title that we want, and this will send the message that we're trying to get out there. So that's kind of how I felt about the title.
Yeah,
Sara?
we wanted it something that was easy to remember. So it's just something like we wanted the word nurse in it. We wanted something
Yeah.
to describe us. And then even the subtitle, right, which is Stories of Grit from the Front Lines, we really wanted the word grit in there somewhere.
Right.
So that's why there's that subtitle, which also took a really long time to kind of come up with. But at the end, I think we're really happy with the title and it made sense to us. Like, how do you give a title to all these amazing stories, right? Because they are so varied. But we thought wisdom was a great way to describe every nurse in that book.
Right. And all nurses,
Uh,
really. Yeah.
you totally all nurses, and I'm going to hand it back to Julie, but I just want to say thank you so much for validating us and our experiences and giving us stuff that's so familiar that you feel like you've just spent some time with a very good friend. You're both delightful, and I thank you so much for being here. And I'm going to pass it back to Julie to tie it all up for us.